What's up guys, welcome back to Community TV, tips and tricks living your best life. In this video, I'm going to be doing a specially requested video on the different types of transmission-based precautions. I know it could be kind of confusing sometimes, and it's definitely going to come up on your test in nursing school and on your NCLEX. It's definitely going to come up. So without further ado, stay tuned, and don't forget to stay tuned to the end of the video where I'll show you as close as I possibly can with the materials I have in my house on how to don and doff PPE. Alright guys, so let's first talk about PPE. What is PPE? PPE is basically personal protective equipment. Exactly what it sounds like. It's there to protect you from any infectious diseases that your patient may have, and it protects the patient as well in a way. So basically we have something called standard precautions. Standard precautions is basically precautions that we use for all our patients, whether we know or don't know that they have an infectious disease. So some examples of standard precautions is hand washing. The technique that you use to hand wash as a nurse is part of your standard precautions, your PPE. You always wash your hands when moving from one patient to the next. That's one of your standard-based precautions. Another example of standard-based precautions is wearing gloves when coming into contact with non-intact skin, blood, secretions, excretions, coughing etiquette. Is also standard-based precautions. It's basically treating patients as if they had an infectious blood disease, even if they don't. You know, you're not gonna give somebody an injection with your bare hands. You're not gonna take blood with your bare hands. I mean, you know, sometimes I've seen some nurses do that, and I'm like, you know what, that's very risky. I know you think like, oh, it's nothing, I did it a million times before, but we have to follow our standard-based precautions to protect ourselves and our patients as well, right guys? So let me not find you guys do that. So anyways, so that's basically standard precautions. And also what falls under the umbrella of standard precautions is like avoiding recapping needles, or if you have to close it, like doing the one-hand scoop. You're using a face mask when you're injecting material, or you're placing a catheter in the spinal cord or the epidural space, anything where you know you're gonna have splash. That's basically standard-based precautions. The basic transmission-based precautions, there are basically three different transmission-based precautions. There's airborne, there's droplet, and there's contact. We're gonna start with airborne. I don't know if you guys ever heard of this movie. I think it was called Airborne or something like that. Or it's basically a movie where everybody was getting a disease because of what was going through the air, like you could just breathe it. Basically, airborne precautions is anything that infectious agents that are traveled through the air. So that's how they get it, right? So some type of diseases that can be traveled through the air is something like tuberculosis, TB. That's why we get it every year, right? We get it annually. Also severe acute respiratory syndrome, measles, which they call rubeola. And there's also varicella, which they call chickenpox. So those are the different diseases that can be spread through the air. So with measles and chickenpox, usually they allow the person giving care to go into the room as long as they are immune to it. But you know, I think it's also good personally to just wear the mask just in case. Definitely, if a patient has TB or suspected of knowing TB, you have to wear an N95 respirator. I remember when I was working in the jail, we had a TB section, and on weekends sometimes I would have to go and, you know, collect sputum from them or talk to them. Anytime they opened the cell, they always made sure the patient wore a mask and I wore a mask just to protect myself for it. So basically, definitely, if somebody is known or suspected of having TB, you're gonna want to have them wear a mask if you're coming into contact with them, and you're gonna want to wear the mask, right? So that's the transmission-based precautions you would use. Usually, yes, they would be in their own room with the door closed, and they would usually have negative air pressure within the room. I remember when I was working in jail, I had to do something called a smoke test on weekends when the nurses that did TB were off. Basically, you put a smoke in a room, and then by the way the smoke goes inside the room, you could tell that the room is working. If it's not working, we would have to inform facility facility personnel and let them know so they could fix it. 6 to 12 air changes per hour, or you know, they have like a filtration thing. So that with the airborne precautions, it's really important that you wear your mask, your N95 mask. Usually N95 masks are fitted for them. So make sure you have that. You know, it's your responsibility to make sure you have it. Transport the patient out of the room if it's very necessary. We rarely transported a patient with TB out of the room. If they have to, make sure they wear a mask as usual. Another base precaution is droplet precautions. So droplet precautions are infectious agents that are spread through large particles. So such diseases are like such diseases that are transmitted through droplet precautions is the adenovirus in infants and young children, unfortunately, rubella, mumps, and diphtheria. So those are spread through droplet precautions. So of course you're gonna want to have your mask, you're gonna want to have your gloves, and you're gonna want to have your gown, because droplet can, you know, basically spread through everywhere. Like if they achoo, they could go into your skin, it could absorb in your skin. You don't have your gloves, you want to have your goggles so it doesn't go in your mucous membranes in your eyes. You're gonna want to have your mouth covered, all of that covered in droplet-based precautions. Usually when people are visiting somebody with who are on droplet-based precautions, they want the visitors to stay at least 3 feet away. They say the door can be open, but they prefer the patient to be in a private room if possible. So wear your PPE upon entry to the patient, upon entry inside the patient's room. So as soon as you go in, like, make sure you have your PPE as soon as you go inside, and of course when you're leaving, make sure you remove your PPE before you leave the patient's room. I'm sure we hear it time and time again, but you must remove the PPE before you leave the patient's room, right? I'm sorry guys if I'm talking like this, I just have a little cold. Last but not least, contact precautions is the last one. So contact precautions is basically what it sounds like, anything that you can get through contact. So let's say the patient has C. diff, or if they have MDROA, which is multi-drug resistant organism, you're gonna want to make sure you have your contact precautions. So what we're talking about contact precautions, we're talking about gloves, we're talking about gowns, even goggles and masks, because you never know if something like splash, like depending on what kind of care you're doing for the patient. Like let's say you're changing the patient, there's a possibility to splash, especially if it's a baby or something. You're gonna want to wear your contact-based precautions caused by direct or indirect contact with the patient. So even if you're in the patient's room, you're not touching the patient, you could touch their phone or their desk, which they touch, and you can get it because you touched it. So that's why it's basically important to put it on upon entry into the patient's room and absolutely remove it before you leave. So you don't want to spread that germs all around the hospital or nursing home or the home, wherever you work. To place the patient in a private room if available, and also do not share equipment. I don't say avoid, but it's best to not, like really try not to share patient equipment with the other patient. All right guys, so let's get to donning and doffing PPE. All right guys, so when you're first putting on your PPE, the first thing you want to do is you're going to put on your gown. So this gown I already used in class, so it is already kind of like broken here a little bit. So we're just going to make believe we tie it, right? So the first thing we're going to do is we're going to put it on like so, right? So we're putting it on, putting it on, and you're going to want to tie it in the top, right? You're gonna just make it like a simple knot. You're gonna tie it in the top, and you're gonna tie it right here at the waist. And you're gonna tie it right here at the waist. And then the next step you're gonna do is you're going to put your mask on. But I have a face shield, so it comes with the goggles too. But so I'm gonna use this. And then make sure it fits your face like so that you know you have no air coming in or air going out. Of course, if it's a patient with TB, you're gonna use your N95 and stuff, and then you put your goggles. But with this, we have it like that. It fits, it's good, nothing's going in, nothing's going out, we're good. So the next thing we're gonna do is we're gonna put on our gloves. Of course, if we're putting on sterile gloves, we're gonna use the sterile glove technique, but make believe these are just regular gloves. These are my house gloves. So I'm gonna put it over the cuff of the gown. So we're gonna put it over the cuff of the gown. Yay! And then that's how you put it on. Oh, look at that, sliding. So it is a slide, right? So how you take it off is you're gonna want to take off your gloves first, right? So in the NCLEX, so you can remember, the way you put it on, my teacher taught me, is on yourself, on and up. So that's basically how you put it on. So on, you put your gloves, mask, up, like on, and then out. So glove, gown, mask, goggles, gloves. And how you remove it is alphabetical order. So you take your gloves, and then you're gonna wanna not touch it. So you take your gloves, make sure you don't touch the contaminated area, slide it like so, and then you ball it in this one, right? Then you're gonna take like maybe one finger, make sure you don't touch the contaminated part, and you remove it like so. Okay? Throw it in the garbage. Okay? So the next step is you take out your goggles. Your goggles will be first, and then your mask. But in this case, I only have my face shield, so I'm removing it like so. Actually, if you have a respirator, you would remove the goggles first, then you would remove the gown, then you would remove the gown, and then remove the respirator when you are outside the patient's door, because it doesn't make sense if you remove your respirator while you're in the patient's room, you're gonna breathe it in, so what was the point of it, right? So you remove the respirator when you're outside the patient's door. But in my case, let's say the patient is I don't know, contact, right? And then I'm doing something where it turns of splashes. Let's say I'm suctioning the patient, so I take out my face mask, so that's it. So the next thing we're gonna do is we're going to remove the gown. So you would untie both at the top and at the back, and you would kind of like shimmy a little bit to kind of get your arms loose, right? You get your arms loose, and then you would use that to kind of like slide out. If you have some trouble sliding out, you're just gonna want to try not to touch this contaminated area. Let's say it's contaminated all over with MRSA, right? So you take like one finger and you slide it in like so, right? So this is a contaminated area. So this is a contaminated area, right? So you slide out. Slide out like so, and then you roll it outwards. You know, you slide out as much as you can, and you roll, and this is the inside clean part. All right, guys, so that's how you don and off PPE. I hope you guys loved it. I'll see you later. Bye.